Who's watching your home when you're not there? Protect your home with a security system monitored by ADT, the leader in home security. Just call Protect Your Home, your authorized ADT dealer. Call now and get $850 of hardware and activation for free. Call 1-877-653-8844. That's 1-877-653-8844. $99 installation charge. 36-month monitoring agreement at $35.99 per month. Call for terms and conditions and Protect Your Home license number.
Hi, guys.
Talk Radio.
Hi, guys. It's Harvey from All Parts. Well, I'm with my friend Dr. Dave. Originally, we weren't friends. I had a bad MBA out in Long Island, and originally I met Dr. Dave and wound up to save me where I can walk. Dave's on the phone right now. Dave, why don't you introduce yourself?
Hi, guys. I'm Dr. Dave Hargraves, chiropractor here in the Outer Banks of North Carolina.
All right. Dave, when we first met, I know it was a while, because it took a while before I saw you, but what did you have to do to distinguish? Because I went to other chiropractors. They never took x-rays. They just crunch you and stuff like that. Is that a good thing or a bad thing? Or what should chiropractors do in good practice?
Okay. Well, we are held to a standard of care that we are taught at school, but we are required to do a thorough history, an orthopedic exam, neurological exam, make an assessment, make a diagnosis. Also, further studies such as x-rays or MRIs may be needed to aid in that diagnosis. And then if we feel we can help the patient, we let them know and let them know what will be involved in a care plan. And if we see things that we don't think that we can help with them in our scope of practice, we do refer them out.
Okay, yeah, I remember that. It's been so long ago, I forgot all about that. Now I remember the x-rays. That's pretty good. But I have another question, because my father used to believe in x-rays, not x-rays, but chiropractors. And I used to see my father used to see tiny, tiny women. And not knocking them, they may be good, but there's times when I'm really hurting and I can't really see what you're doing, but I hear your feet jump off the floor, which that means that you must really apply real good pressure. I mean, I feel excellent after you're done, but I must be a hard case to adjust. So is it better to have some weight behind you and some muscle?
Well, a lot of it, there is a certain physical aspect to what we do, but a lot of it is knowing the precise angulation of the joint planes of the joints and vertebrae that we're moving, and speed is a factor. But there is a certain physical aspect to this, so it definitely does help in what we do as far as the manual adjusting with our hands.
Yeah, because I've been seeing you now for, I think, last 7 years. I started out seeing you, 3 days a week. And personally, between you and me, without your care, I think I would be in a wheelchair about now.
Well, I've heard similar stories, but the injuries that are suffered in motor vehicle crashes are generally sprain-strain type injuries. Sprain means you've torn a ligament, and a strain means you've torn a tendon, which is part of the muscle. And in the spine, the tendons and ligaments actually blend together and they anchor together in the bones. So it's physically impossible to tear one without the other. And they are permanent injuries as they heal with scar tissue. In the long run, you're almost better off breaking a bone than tearing the joint slightly. So this is why people need lifelong care, because these injuries do tend to reoccur because they are permanent injury.
And I have another thing to ask you, and Jean, my wife, thinks I'm crazy. I can actually feel if there's going to be a bad storm coming or going to be a light storm. I can feel weather changes. Have you heard that a lot?
Oh yeah, a lot of it's grandma or grandpa can tell when there's a storm coming because their knee or elbow or something starts acting up. But there's a very physical and real aspect to that, and it has to do with the way that we regulate our heat of our core temperature by shifting blood in toward the core when it's cold and sending it out when it's warm. Also, the pops that you hear when we give an adjustment is gas that zips out of the joint. And to be technical, it's nitrogen gas. There's a little trivia there for you. So as the low pressure comes, those bubbles do expand and, put pressure inside the joint also, and that makes the muscles get tense. So Grandma and Grandpa are right.
Okay. When you first saw me, I know I probably acted like a lunatic, but you got me squared away. One time a week doesn't work with me. Why do I have to see you 2 and 3 times a week? Why does things keep popping out? Is this going to keep popping out the rest of my life?
Unfortunately, yes. Everybody's an individual, and you have to take everything into consideration, the actual person themselves, the injury, how the injury happened, what was hurt, and so on. But with gravity always pulling us down, these joints are going to want to shift to where they kind of got injured to. Again, these are, permanent injuries by a permanent stretch, if you will, of the joint capsule that holds our bones together. So some people come twice a week, some once a month. It's tailored to an individual, but they're going to be with you.
That doesn't sound promising, but I saw you, like I said, I saw numerous chiropractors, and I think you're the leader on the Outer Banks. I heard that I know a couple of times when I sprained my wrist, you can do wrists and everything. I understand. One time I think you told me you can adjust dogs. How did you come across learning about dogs?
I was looking through one of my journals, and I saw this advertisement for a veterinarian that teaches people how to adjust animals. And I've always loved dogs and animals. So I went down and took the seminar from this doctor. He's actually a veterinarian who was on the surgical staff at Washington State University, and he did some research, and we have an instrument that a lot of people call a clicker. It's actually called an activator, and he found using that he was able to get dogs in particular and horses and cats better. So I've probably adjusted, 100, 150 different animals, and the results are amazing. It's, you never know what's going to happen, but we've seen some pretty amazing things after working on animals.
Yeah, that sounds... So if somebody has an older dog, and if they need adjusting and they hear about you, can they bring the dog to your office?
Yeah, usually I'll do that, after hours. I've also, there was a veterinarian that I was working with at the area, and they allowed me to come to their office. Sometimes I'll just go to the person's house, and the animal feels more comfortable in the environment they know. So, animals are wired a little bit different than we are. So when you use a clicker on them, it tends to do a lot more on an animal than it does on a human, in my opinion.
So in theory, if I would be doing better if I was a dog.
Well, maybe.
I know I'm a basket case. I know we're going to wrap it up. Nobody showed that, which we talked about, which would be fine. Why don't you, because this plays constantly, why don't you tell them your phone numbers, how to contact you? I know you're going to start doing a website, and you're going to, well, hopefully we're going to set up a 900 number where people can call and give advice. Why don't you give a little bit, if they want to call you now, what kind of phone number to call in and whereabouts you are on the Outer Banks, and talk a little bit where you are and what your phone numbers are and what can you offer people.
Okay. Well, we are the only Outer Banks chiropractic clinic. We're located at milepost 10 1/4 on the bypass. Our phone number is 252-441-1585, and you can find us on the web at outerbankschiropracticclinic.com. We're open Monday through Friday. I do work with the local orthopedic neurologists, neurosurgeons, and medical doctors in the area, as well as physical therapists. You'll get a thorough exam, x-rays if needed, a care plan, and basically if we can't help you out within a couple of weeks, if we're not seeing any kind of improvement, we will refer you to the appropriate doctor.
Well, I know over the years, I know it's rough. I've been seeing you since my MVA, but I know for me it's a big improvement. If I don't see you for 2 or 3 weeks, which is not that often, it takes me about a week and a half to get me where you used to have me. Why does that happen?
First of all, I just like to make a correction. It's outerbankschiropractic.com. I misspoke on the website. What happens is to answer your question, the old injuries start to resurface. The joints don't function properly, causes irritation in the joint, which the inflammation or swelling that causes a pain in the joints. The end result of all inflammation is scar tissue, and that gets laid down at about 2 to 4 weeks. So as a rule of thumb, I tell people never longer than a month, just to keep that scar tissue from kind of gluing everything up in there and just keeps everything moving, because everything follows function. Life is motion.
All right. Well, say, argument's sake, I'm an elderly person and never saw a chiropractor in my life, and age is starting to creep up on me. I know you give excellent evaluations or anything. Would it be a good idea for somebody in that age to see an excellent chiropractor such as you and see what you could be done?
Thanks. Yeah, absolutely. The youngest person I've adjusted is 6 days old, and the oldest person is 96 years old. I've never really had anybody that hasn't gotten some sort of improvement, even starting in their 60s or 70s or 80s. In fact, I had one lady, she had never been to a chiropractor. She's, I think, 86 years old, and she wasn't able to walk. She couldn't lay down. She was in excruciating pain all the time. After about 2 weeks, she's sleeping through the night. She's able to walk around, and she's doing a whole lot better. So it's really never too late.
Okay, I know one thing's going to have to happen. We're going to do this again. I'm going to invite you again, but I think next time I'm not going to have you in my studio because there's a nasty echo, and I apologize, everybody, for the echo, but try to survive to the, echo, guys. If you're through the Outer Banks and everything, see Dr. Dave. He's excellent. We became friends over the years, and I'm sure we'll become friends over. Let me ask you one more question, because I really don't know. Say I'm a person that's vacationing down here, and I see a regular chiropractic person, and I'm just hurting, and I'm down here for 2 weeks. Do you see people like that?
Oh, all the time. In fact, we get a pretty significant rise in patient numbers throughout the summer. A lot of improper lifting, sitting in and out of cars and planes, sleeping in beds they're not used to. If someone's seen a chiropractor, if I need to, I'll call them. I have my own X-ray in my office. I take insurance, all the major insurances, except maybe one or two. But vacationers are welcome. If you call, you will be seen that day. So if someone's hurting, they'll get help. And but no, we love vacationers. In fact, we have quite a regular following of vacationers. They'll come down and see me 2 or 3 times while they're here on vacation, and then just it doesn't interrupt their care schedule at home. If someone's never seen a chiropractor, we explain to them what we're doing, treat them just like any other patient, and then we try and help them find a good chiropractor back where they're from.
Also, I want to tap into something because I think it's quite amazing. And I think it happened about 2 weeks ago. You and I and our wives were going to meet, and you were running late because a patient called from I forget where. Can you explain that? I mean, I don't mind that you came late for dinner, but it's unusual for a chiropractor to get a phone call at the last minute and actually do something. Do you do that a lot?
Yeah, I mean, it doesn't happen a lot, but when it does happen, we're there for the patient. And if I know someone's running a little bit late or something happened, and I'm around and able to help, I'll definitely wait. Obviously, if there's a severe injury or you call 911. But if we're there and they can get a hold of me, we'll wait.
I know last summer I was trying to be busy, and there's a couple of times that I see your truck parked out in front of your office. I know you do a lot of work outside your office. I knocked on the door, and you greeted me with arms and everything. I know we're friends and everything. We're becoming friends because I know you so long. Would you do that with other people you just saw, say, 2 days ago?
Yeah, sure. I mean, that's what I do. I'm a head doctor and head janitor, so I'm down there all the time, and if someone sees my truck, which happens, now and then, and they'll pop in and we'll take care of them.
All right. Well, I have more questions, but we don't want to make it too long. Do you have any problems as maybe I can schedule another show and we can do it from your house because the echo is quite bad to get rid of the echo? Would you mind helping me do another 3-4 shows and see how it does?
No, I'd love to. I love doing this. Educating the public is one of the things I enjoy doing, so be happy to.
Okay. All right, guys. My name's Harvey from All Parts. Dave, I'm going to hang up on you right now, and I'm going to, so you're going to hear a click. I'm going to say goodbye. Go ahead, Dave. Say goodbye to everybody.
Okay. Take care. Have a good day, everybody.
All right, that was Dr. Dave. Again, this is Harvey from All Parts. I am definitely sorry about the echo. This is the first time I had a caller with my studio. So next time we're going to have him call either downstairs to get rid of the echo. But if you guys are coming down to the Outer Banks, I know I've been seeing him, I think, since 2003. I recommend him. I've been using him a lot, and he's a good chiropractor. So again, my name's Harvey from All Parts Pool and Spa. If you come down to the Outer Banks and see the doc, I think you'd be quite impressed. It might even let you have an excuse to come to the Outer Banks because once you get adjusted by Dr. Dave, there's no other better chiropractor. Now, you have to remember, guys, I lived in Arizona and New York and the Outer Banks. And my father used to live by chiropractors. And I know Dave since 2003. And let me tell you, if you got a pain, he can find it and he can adjust it. Okay, guys, again, this is Harvey, and you're on the Outer Banks. See Dave. I think you'll be happy. Take care, guys. Bye.